All right. Welcome again, everybody. We will just go ahead and get started. I have shared our presentation this evening to our YouTube. I will kick us off. Hopefully we will have more attendees join us as our session is underway. For those of you that have not met me, do not know who I am, my name is Capri Bell. I am the Executive Director for I Will Survive, Inc. We are thrilled to have you all here today. We have some phenomenal guest speakers that you'll be hearing from in just a bit. We have our lovely Sierra Scarborough, our Program Director for I Will Survive, and I cannot wait to introduce you or have Sierra introduce you to our guest speakers. But wanted to introduce today's festivities. So our program tonight is called A Night of Fashion and Wellness. Typically under non-COVID times, this would have been an in-person lovely gala where we'd all be glamored out and fashionable and together. But of course, we want to make sure everyone is safe. We take that as top priority and wanting to make sure that, we know that there's rising cases. So just to make sure everyone is safe, we've decided to just pivot a bit and host this event virtual as best as we could. So unfortunately, you won't get a fashion show this time, but hopefully soon we can resume to in-person galas next year and the year after. So without further ado, thank you again for joining us, and I will turn it over to our program director, Sierra Scarborough.
Sierra? Good evening, everyone. My name is Sierra Scarborough. As Capri mentioned, I am the program director for I Will Survive, Inc. And my job is to help organize and put on events for the organization. And I will love to invite you and happy that you're here for this A Night of Fashion and Wellness. So for us to get started and for us to learn just a little bit more, we will be doing a little bit of an icebreaker. It is trivia icebreaker style. So if you want to, you can come off mute and answer the questions, or you can put it in the chat, whichever one you feel most comfortable doing. So the first question is true or false? Plastic water bottles can cause breast cancer.
False.
I hear one false.
I think yes. I think it's true.
True. Anybody else? It is actually false. Plastic water bottles cannot cause breast cancer. It's very interesting. I didn't realize it until I looked it up, but no, plastic water bottles cannot cause breast cancer. All right. Next question is also true or false. If a woman's mother, sister, or daughter has had breast cancer, then she has an increased risk of breast cancer. True or false?
Fuck. True. True.
It is true. Great job, everyone. All right, so for the next question, true or false? Getting a mammogram puts me at a higher risk of getting breast cancer.
False.
False.
Oh, it should be false.
It is actually true. Good question.
Wow, radiation.
The radiation can help.
Oh.
Yeah. Wow.
So it's a good trick one, huh?
Yeah.
All right, on to the next question. True or false? Wearing an underwire bra increases my chances of getting breast cancer. Here, one false. Anybody?
Oh. I have no idea. I'm not batting really well, so I'll say true.
It is actually false.
Oh, well. Well, that's good.
That is good. All right, on to the last question. True or false? I have not had any children, so I cannot get breast cancer.
That is definitely false.
What?
That's false.
I have not had any children, so that's false.
Yeah, that's definitely false.
False. False.
False.
I hear a democracy, so it is false.
Oops.
Yes, it's false.
It's false. The law.
All right, that is it for our icebreaker. Good job, everyone. And let's get started with our guest speakers. Oh, I'm sorry. Actually, I'll turn it back over to Capri to talk a little bit more about I Will Survive.
Thank you, Sierra. And thank you for those true or false questions. You know, it's so funny because I feel that we've all heard some of these, right? You know, we've all heard sometimes some of these statements, and sometimes it's hard to tell what is true and what is false. But one thing we do know for certain is that breast cancer, like all cancers, do not discriminate, right? So there's no absolutes. I feel like that last one, when it says I cannot get breast cancer, there's never a not, you know, there's never an absolute anything, because like any kind of, illness, chronic health disease, it does not discriminate. And so thank you so much for that. I thought that was really interesting, and there were some trick ones there. So thank you, Sierra, for entertaining us to kick off this call with a little bit of energy and participation. Thank you again. So a little bit more about the organization for some of you that are on the call. You've been with us for a while, so you know you're very much familiar with our organization, but we are a nonprofit located here in Atlanta, Georgia. We were founded in 2010 by combat veteran Anissa Palmer. She knew that she really wanted to do much more for the community, especially those affected by breast cancer. She, losing her mother at 5 to breast cancer, really knew that she not only wanted to do more for those in the community affected by breast cancer, but their families, but to be an extension of family. So this is why we really strive in our programs and how we launch our programs, how we help the community. And so, since the inception of I Will Survive, we have continued to focus on ensuring that we are helping with economic support. So this could be in the by way of rental assistance, mortgage assistance, utilities, transportation, food. Prevention education could fall under our hub right now. We're offering free mammograms. I'll say that again. Free mammograms to those that are uninsured or underinsured to help, again, to launch our commitment to prevention education. And then our health and wellness services program. And we have one of our fantastic champion. I want to call her our partner. I want to call her so many things. You'll meet her in just a moment. Yeah, Coach Ya, for that matter, when she helps us every year on our launching our fitness program in July, typically to help our fighters and survivors with a fitness journey. But again, it's not limited to just fitness. Of course, health encompasses everything. Physical health, mental health, holistic health and care, nutrition, all of the above. And so we are really committed to these kind of targets and really strive to push these forward annually. Yes, we are continuing to thrive and grow, and we will continue, like any nonprofit, to make shifts to some of our programs, but we are really committed to that as the basis of who we are, and we really strive to continue to be that organization here, not only in Georgia, even outside of Georgia and outside of the United States. Actually, we've had a few clients out of the United States. So again, if you know of anyone that is seeking our support, if you know anyone that needs some assistance, they are struggling in any of the areas that I just mentioned, they have been affected by breast cancer currently or prior, they know someone that is, please send them to us. They can find us at www.iwillsurviveinc.org. We'll make sure we drop that in the chat as well. But again, we are happy that you're here. Do not let this be the last time that you connect with us. We want all of our family members, clients, and partners to stay connected to us, because we do know that the work does not take one person. It takes all of us to work together. And I know that all of us could personally and professionally probably attest to the fact that we know somebody that has been affected by breast cancer. So we are better together. Let's do this together so more people can continue to thrive and survive. Next slide. All right, and here's a short PSA that we wanted to just share with you all as well before we kick off our wonderful speakers.
Every 2 minutes, a woman is diagnosed with breast cancer in the United States. 2 minutes. Think about all the activities that you can do in 2 minutes. In 2 minutes, you can brush your teeth, send a text message, or listen to your favorite song. In addition, 1 in 8 U.S. women will be diagnosed with invasive breast cancer in their lifetime. In 2021, an estimated 281,550 new cases of invasive breast cancer are expected to be diagnosed in women in the U.S., while around 43,600 are expected to die of it. Globally, breast cancer affects more women than any other type of cancer and is the leading cause of cancer-related deaths among women. Of those women, African American women have a 31% mortality rate, the highest of any U.S. racial or ethnic group. Over the past 20 years, despite the universal drop in mortality rates, we have seen a rise in the incidence of breast cancer in African American women. In particular, disparities between mortality rates for white and Black women have grown significantly. The mortality rate for Black women diagnosed with breast cancer is 42% higher than the comparable rate for white women. Triple-negative breast cancer is diagnosed more often in American women of African descent than in those of European descent in the United States. This community has the highest mortality rate for various reasons, one including a lack of education. We hope to use our voices to urge African American women to learn more about maintaining optimal breast health. So our focus was education regarding early screenings, since this can help with early detection of breast cancer. This is why we've decided to work with I Will Survive, Inc., an organization whose mission includes prevention education.
I Will Survive Incorporated is a local 501c3 nonprofit organization founded in 2010 by combat veteran Anissa Palmer Warren. After losing her mother to breast cancer, she started this organization with the full intent to not only help spread the awareness of breast cancer through education, but also be a support system for families impacted by breast cancer for those in need. Their mission is to provide economic support, prevention education, and health and wellness services to those at higher risk and affected by breast cancer. I Will Survive upholds their values of innovation, wellness, and sustainability through their provided services, which include the coverage of rent, mortgage, utilities, other financial hardships, health workshops, mammogram screenings, dental services, support groups, transportation, grocery delivery, and many more. I Will Survive Incorporated are tireless in their efforts to serve people of all race, color, gender, sex, creed, disability, and religion. There is no discrimination. They seek first to serve local communities in the metropolitan Atlanta area, then nationally, and then internationally.
I Will Survive Incorporated is actively seeking donations as well as volunteers, interns, fellows, and board members who are passionate about the community and ready to serve. There are more than 3.8 million women in the world who have a history of breast cancer. Your help is necessary. To get involved, seek guidance at iwillsurviveincorporated.org through social media accounts such as Instagram, Facebook, Twitter, and YouTube, or simply call during hours of operation for more information. Know your options, educate yourself, and be a voice for those who do not have one, and together we can make a difference.
All right. I hope everyone thoroughly enjoyed that PSA. And thank you, Capri, again for doing the intro to I Will Survive's history. And so now we'll get started with our guest speakers. In the order of appearance, we'll be starting with Rebecca Douche, followed by Makita Wrighton, and lastly, Ya Astar. And to get it off, let's get started with Rebecca from Park Lane Jewelry.
Good evening, everyone. I'm so happy that Sierra invited me and I was able to attend tonight. I've been with Park Lane. I'm starting my 3rd year. I am an image consultant, so it was just kind of a no-brainer to add this on to it. But one thing I love about jewelry is that it has been proven that it raises your serotonin levels. So, it jewelry does make you happy. So I love to share that with people. And I just want to tell you a little bit about Park Lane. And then I'll show you a couple of fun little tips with jewelry and what you can do with it to create your own unique style and also keep you updated. That's the easiest way to stay updated with the fashions and the trends is through your jewelry. But Park Lane started in 1955 in Chicago. It was a young couple. She was 16, he was 18 years old. And she wanted to do something for women to have to earn money. So what they did is that they hired 3 different companies to say what kind of business they should go into. All came back saying jewelry. So with $1,900 a loan from her mother, Park Lane began, and it's still owned by the same family. It's debt-free, cash-rich, and we're in 13 countries. So I really thought this was even before Mary Kay. So it's pretty unique to see how someone at 16 years old would have all the wherewithal to do this. But it is a designer-inspired fine fashion jewelry line. And we have styles that will match everybody's style and personality, from boho to bling to delicate to classic. And we have a lot of great customer sales that I'll tell at the very end. I have put in the chat box a special link for you guys to utilize from tonight until 10 o'clock p.m. on Wednesday, because there's a special offer that ends on Wednesday night that I would love for you guys to take advantage of for Mother's Day, or to give a gift that's really, really special and save money at the same time. But one of the things that you should always do, especially with layering, and so many of us, what are we doing? We're virtual, so you have to tabletop dress up from the waist up. And your necklaces, one great tip is to layer them. And that means not just by the same color, although I am wearing silver today, but they're actually 2 necklaces, and one of the necklaces is a 2-in-1. So if you don't know how to layer, layering gives you much more eye appeal, and also it is an attention getter. Madeleine Albright, who used to be one of our secretaries of state, she loved jewelry, and actually a lot of her jewelry went to all of these different places throughout the world because they were so unique pieces. And she says, I wear jewelry because, she was a very small lady, but she says, I wore it because it's a conversation starter. So if you have your own business, that's a great way to break the ice. So one thing I'll show you is how you can layer. A lot of our pieces are 2-in-1, 3-in-1. This is called Charm. It actually has 2 strands of unique pieces.
Sorry,
of blue turquoise.
Can I just echo in for a moment? Are you all hearing an echo? Like, because I'm hearing 2 things at once. Am I the only one hearing that?
So if you have your own business, that's a great way to break the ice. So, well, I don't know. Am I echoing now?
Sounds good to me.
Okay. Maybe it was just a section of it. So if it is, let's let me know again. So this is blue turquoise, and then we have another chunky chain, which is one of our trends. But this one is a 3-in-1. So if you just wanted to wear this chain, you can do that. If you want to wear one, you can do that. So I love the versatility. Look for things that if you don't know how to layer, get a pre-layered one. And then you can just add on. You unlock, you undo it, and now you have another look. So trying to be getting a lot more bang for your buck and a lot of different looks is really on trend, and also mixing metals. Like this is 3 different necklaces right here. It gives you, even though a lot of it is like the coins, it gives you a lot of different texture to it. And again, a lot more eye appeal. So you don't, again, have to spend a lot of money. It's just how you know how to mix and match your necklaces. Here again is another 3-in-1. This is in rose gold. This one is called Ambrosia. And then I added this cute little dragonfly in there. So again, it gives you a lot more appeal. If you wanted to take some of these off, you can, and mix it with maybe silver or gold. If anybody has any questions, I'm just kind of going through this a little quickly because I know we have so many great speakers tonight. Again, this is a very simple one, but it's also mixing metals and natural stones. This is a beautiful agate pendant. And you have your paperclip chain, which is the chain of the season, as you'll see a lot of things with paperclip. And then you have your beautiful chain here. You remove this, and now you can put this on another chain, and you've got 2 different other chains with that. So you've got at least 3 or 4 different looks right there. So those are just some suggestions of how, if you don't know how to do it, get something that is already pre-layered that you can also separate. And that's what I would say 90% of our necklaces, you can separate those. And how long do I have? Because I wanted to tell you about the special offer. Is Sierra timing me? Oh, I don't know if she can hear me. Well, that is one of them. And another one that is very, very popular right now is doing your arm parties or stacking of your jewelry, of your bracelets, because this is an expression zone. So pay attention and put beautiful bracelets together. Again, texturize it. Put a chunky natural stone with a beautiful CZ. So again, it attracts attention, but also it makes you feel so much better. So always never forget how important it is to wear bracelets. And I'm going to quickly go over our special that we have through Wednesday. We always have our 2 and 4 special where you buy, the only time you're going to pay regular price is your 2 lowest price items. Then you get up to 4 items more expensive, half off. But once you get to the $90 level with your regular and your half price, you can go back and you can choose. This one I think is $160. You can choose this and get this for $30. You can choose another $200 piece or less for $30. And then you go back a 3rd time and do another one. Like if you wanted the Oakley, you can get this one absolutely free. So with $150, you can save almost $600 and free shipping. It's kind of mind-boggling, but they've never done this one before with that extra bonus item, the free item at $200 level. So there's still time for Mother's Day or someone that needs a little TLC, and wouldn't that be nice for you to share that with that person? That information is in the chat box with my cell number. So if you have any questions, let me know. Oh. Did someone have a question? No? Does anybody have any questions? Because I know, I think Anissa's trying to get on, but.
Yes, that's what it was. I think that's
But I
Does
love.
anybody have any questions with that? We have
I
everything
don't see any
from,
questions in the chat. I don't see any questions in the chat as of right now, Rebecca. Can you all
okay,
hear me?
yep,
Yes.
I can hear you.
Perfect.
So if
Thank
you
you
have any
so much
questions,
for
let me
that.
know. But, you know, I'm here to spread the sparkle, but also, you know, this really does help people, make people feel better. And I love to make people happy and through joy.
Thank you so much, Rebecca, for that. We appreciate you so much for your partnership and appreciate your time as well this evening. So thank you so much.
Thank you.
Let's see if Sierra is still here. Sierra, are you still on to introduce the next speaker, or would you like me to?
I'm still here. Sorry about that, Rebecca, earlier. But thank you so much, Rebecca. Park Lane Jewelry is beautiful jewelry. And so now I'll go on to our next guest speaker, Miss Makita Wrighton. Makita, I did add in your slides to the slideshow, so just let me know when you are ready for me to advance the next slide for you.
Sounds good.
All right, and you are good to go.
Okay. All right. So we can open up with the first slide. I'll do a brief introduction to everybody. Can you hear me okay? Okay, getting a little feedback, but that's okay. We know we're on Zoom, so we work through it. But we can open up with the first slide, Capri. And as she's pulling up the slides, just so you know, I am Makita Wrighton. I am an oncology social worker. I work at Grady as an outpatient supervisor in the department. I've been a part of Grady for almost a little over 20 years. So I've been there quite some time working with just a variety of different areas, including breast cancer. So I come with knowledge of the hospital experience, wanting to just today share with everybody about the oncology social work experience. And so we'll begin our discussion today just sharing from a patient perspective of what an experience is like to start out with. And then we'll talk through a few of the slides if we're able to get them up, and talk about what the value is. The title of my presentation today is The Secret to Your Success, Understanding How Your Oncology Social Worker Can Help, which we've already talked a little bit about self-care and image with Rebecca. She shared with us tonight just the value of jewelry and what it can do for you. And so it's important to know what things can be helpful from big to small. I like to say nothing is really small when it comes to what can make you feel better. But in our presentation tonight, we're going to talk through just the value of having your oncology social worker as a part of your team and how impactful that can be as you are walking through your experience. And so that's what we're going to talk about tonight. Let's see. Are we getting slides up, or because if they can't come up?
Yeah,
it's
just
okay.
let me know when we go to the next slide.
So I'm not even seeing slides. Is everybody seeing slides but me?
The slides should be up. You can't see the screen?
I can see them now.
Okay.
I had to change my my view. Thank you. Okay, so as we talk about objectives, we're going to talk about the oncology social work role. We're going to look to talk about the empowerment of walking with a social worker and the cancer journey, and being equipped to succeed with the tools that an oncology social worker will share with you. And then we want to be inspired. So I want those of you all who are on the line tonight to just have a feeling of understanding and, like I said, the value of what a social worker can do as you walk through your experience. And so next slide. The experience that I want to start off with is just imagining being in a doctor's office and reviewing the actual results with a provider and talking with them, and what that would feel like, sitting there hearing the word breast cancer or cancer, and what that does. And then as the doctor talks through all of the different treatment plan and talking about, and they usually are very compassionate and try to make certain that you feel as good as you can given what they've just shared with you, then you start to meet a team of people. And so tonight, what we're going to do is look at some of the questions that come up when you are in that office. And we're going to look at some of the questions that after you hear that news, you automatically go to. So after hearing that cancer diagnosis, either in the office or if you read it online, because some of the doctor's offices now are using the My Chart and the electronic medical record to provide your diagnosis, the first thing that usually comes to mind is this really me? Is this really mine? Is it my mammogram? Is it my path report? And you're trying to kind of just work through, okay, I can't believe this, the shock and just what this experience is. I just cannot believe this is me. Then you go through, where do I begin? Who can I talk to? What do I need? How or do I tell my family and friends? And then, of course, that, am I going to die? Am I not going to make it based upon what the doctor is saying? And so when you have all of these questions coming in your mind, and you're meeting a team of people, you need someone to come in and share with you from a perspective of what's your most important concern. Where do you want to begin? You've at least heard what the doctor said. In most circumstances, you heard it, but trying to process it and trying to go through these questions in a quick, fast manner. And so that's where your oncology social worker comes in. That's when an oncology social worker becomes important, because what we do is we basically take a pause, because we recognize that you've received a lot of information, and we say, okay, you've heard a lot. I'm a part of the team for you. So we're going to just take a pause and we're going to begin where you are. And so what is the role of the social worker and how do they become valuable to me is something that most people like automatically think about. They automatically think, well, is something wrong? Am I, it's a lot of times they go straight to the, is something wrong? And are they trying to prescribe me with something because the social worker is coming in? And it's not at all that. It's the fact that the social worker brings a certain special set of skills that combines both the medical, we have a medical knowledge, basic layman, able to talk to you on your terms, and then we have a respect for who you are. So the combination of both those expertise combined with, I want to start where you are, is what your oncology social worker brings to the team or brings to you. So we automatically come in ready to empower, educate, and be there for you. We like to call it starting where you are. We also try to make certain that we give you that inspiration. So at the bottom, it says, let your faith be bigger than your fear. So we want to share some type of impactful saying that will, as you've got this news, give you the ability to be able to deal with and understand that somebody is concerned just about whatever you want to be concerned about. If it's that I don't want to hear from another person in my room, we got you. If it's something like, I just want to deal with everything and I want to try to get all my ducks in a row before I leave today, we got you. If it's resources, we have you. So the social worker is a part of the team and there for you to be able to help you from the beginning to the middle and to the end. And so Next slide, we're going to look at specifically some of the things that we believe, but one of the things that we focus on is, like I said earlier, we start where you are. We want to just take a pause and we want to see where you are. Are you overwhelmed? Is it too much? Is it, okay. And so wherever you are is where we're going to help the team get. So we become very early advocates for you as you're going through the experience. The other thing is that we want to encourage you and empower you. So we want you to know that you are the expert. You know you better than anybody else. And we need you to help us to know what you need. So we respect your opinion and your life and your needs, whatever those needs might be. And then we want to help you figure out how to meet those needs. So we want to put together a way that you'll be able to put your needs first and put everything on the list of priorities that you have in order for you. The doctors might be concerned first about your first treatment and about, your first appointment and all of that. You might be concerned about just emotionally trying to get there, or you might be concerned about just how you're going to be able to take your time off of work. You might be concerned about support groups. You might be concerned about, how do I tell my family, or this is the worst news that I've ever received. Your concerns are what we're trying to focus on. We're trying to deal with your concerns first. We want you to understand your medical treatment. We want clarity. We want you to understand who's a part of your team, your emotional well-being, your quality of life. We want you to be concerned about whether you're going to make it or not with this cancer based upon what the prognosis is with the diagnosis. All of that is what we want to make sure that we help you with. We have our expertise. We oncology social workers go to graduate school, so we do have expertise. We do in the area make certain that we know what your treatment plans are. So with breast cancer, I have a wealth of knowledge. I'm very comfortable talking about what the usual plan and process is, so that if you get to a point where you just need some reassurance or you're concerned about specific things, I can do a basic explanation to you. And so it's important that if you have these kinds of needs, and most people do, usually you have an oncology social worker as a part of your team, but you do a lot of times have to request it. When you go to your doctor's visit at the beginning, at the middle, and at the end, you usually are going to be given what's called a PHQ-9 for follow-up. You're going to be given an NCCN distress, or something that's going to evaluate your emotional well-being. And then you're also going to be given things like social determinants of health. In healthcare now, we recognize that if we don't take care of your psychosocial needs, then we can't take care of you. And so that's what your oncology social worker brings to the table. We want to focus on you. The saying that I have in terms of inspiration at the bottom says that I have learned that people will forget what you said, but they will never forget how you made them feel. And that's Maya Angelou. So the social worker's role is to focus on how we make you feel. And next slide. As you're going through your treatment process, the middle of your journey, again, entails a lot of questions. Entails questions about side effects and doctor's visits and working and how you work through this experience and who can I talk to and what would be supportive. And, it's just a variety of different things. Am I allowing my friends or family to do too much or too little? And so the social worker role changes as you go through your treatment. In the middle of your process, we're trying to talk you through what do you need, what you might change, what you need to educate your family and friends about, what you need to pull in from a support standpoint. And so we're here again, but usually you have to request us in the middle of the treatment. At the beginning, we always start out with you. In the middle and in the end, it's something that you usually have to say, hey, I need to discuss maybe my FMLA. I might need to discuss Social Security. And we are educated on resources. I Will Survive is one of those wonderful resources that is out there that would be impactful in your life. And the social worker has a knowledge base of specifically those psychosocial resources that would help you with your needs. And so in the middle, we want you to ask for your social worker again to try to address some of those concerns. And then preparing for advanced directives and advanced care planning. You might need some equipment because the treatment is causing you to have difficulties with a variety of different things. And so we're here to help. You need to follow up with your HR, your FMLA, and your family. Whatever that might be in the middle, you need a support group, you need a virtual group, you need, education, whatever that might be, exercise, jewelry, wigs. We're here in the middle, just like we're here in the beginning. Next slide. In the end, our role changes a little bit more because as we are understanding, just what you might need, the doctors are now talking to you about different places or continuation of treatments. In some circumstances, they're not talking about continuation of treatments. They're asking you about survivorship. Can you return to your job? They're asking you, you're going through things relating to side effects. And so the social worker, again, at this phase is another valuable resource. And what we try to do is, again, keep you encouraged, talk you through this new normal, talk to you about what resources are good. Are there work programs out here that might be helpful in your journey? Do we need to continue to advocate with your FMLA? Has your 12 weeks come up? Those are the different things that we would talk to you about in this point. Is it survivorship? Are there end of life resources that we need to talk to you about? Do we need to educate you about hospice as a part of what the next step in your care plan is? So we, again, provide that. And we remind you, once again, you are in control of this entire experience. You are the one that will allow the treatment team to know what you need at this phase in your journey through breast cancer. Our final saying that I want to share with you tonight, next slide, just encourages you that your cancer success is in your eyes. It's in the eyes of the beholder, and that's you. You get to create what that success looks like. As the oncology social worker, like I said earlier, our role is to empower and equip not only you, but your whole support team. We're here for you. If you don't have one, if you don't know about yours, please ask about your oncology social work and know that we are here to help you through the entire process to achieve success as defined by what your success is for you. And tonight, I just want to thank you all for allowing me to share just a little tidbit on just the oncology experience and the oncology social worker and what our role is to help you to be successful. And that's the secret. That's the secret, because a lot of times you don't know that we're here beginning, middle, and end. Thank you.
Thank you so much, Makita. I really enjoyed your presentation. I'm going to be honest, I have never heard of an oncology social worker until now, but it sounds like your work is very important, especially with people who are going through breast cancer. Thank you. All right, on to our next presenter.
Thank you.
Thank you. Ya Aser, our beautiful, wonderful in-house, I guess you can call her in-house fitness trainer. I'll let you take it away.
Absolutely. Well, first of all, I definitely want to say, I also have not heard of an oncology social worker. So that could have been really, really beneficial for me when I was going through my treatment. So I'm a breast cancer survivor. I was diagnosed at the age of 27, going on 28, stage 2. And I will definitely say that you talking definitely brought back memories for me, because I can remember I was in the office in April. It was such a long journey because it started January 2005, where, okay, well, I was working for the Department of Health and Human Services in Washington, D.C. at the time. And I can remember, I was, pretty active, and I felt these kind of bumps under my arm. And I was like, I wonder what this is. And so I talked to one of my active coworkers, and she said, oh, it's probably fibroids or something like that. I said, okay. Well, March came around and they were still there. And I said, well, I guess I better go get these checked. So at that time, I would like to call them bee stings, kind of breast size. They were very small, so they couldn't necessarily do a mammogram on me, so they had to do a sonogram. And so they did the sonogram, and they weren't too sure. They're like, we're not too sure what's going on here. So, and I'm glad, and they went ahead and did a prescription for me to do a mammogram. So the mammogram revealed, so they did the mammogram, they still couldn't see anything. So they did a biopsy. So everything is going by so quickly and so fast. But you see, I was on track to, do this whole, grad school thing and everything like that. So I didn't really pay any attention to it, but I still honored my appointments. So I can remember in April, they did the biopsy and everything else. And I'll never forget the date, June 5th, 2005, I was officially diagnosed with stage 2 breast cancer. And I remember going to the doctor's office, and he was saying, you have stage 2 breast cancer. Anything he said after that was womp, 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 because I was in shock. And so I called my sister. She's a nurse. And so I said, talk to her. I don't understand. And I felt like my life was just taken from, the rug taken up underneath me. And so my journey began. So I can remember seeing my oncologist, and we started, I'll never forget, my first treatment, August 3rd, 2005. But I had a lumpectomy in July. And so I had to drop out of grad school. But I'll never forget, for me, it was probably the most loneliest period in my life. You see, my biological mother was in Jersey dealing with her life. And then I wasn't necessarily close with my dad and his side of the family. So therefore, it just left me with just me. And so when I said it just left me, for me, I drove myself to every single chemo appointment. I drove myself to every single radiation appointment. I drove myself, if it was surgery, and if I could drive myself home, I did that too. Because I was not familiar with programs like I Will Survive Inc. I didn't know. So the only thing I knew was I have to figure out how to make this work. And so I was very fortunate where at the time people donated their leave to me. And so they donated leave to me. And so because it allowed me, because I was sick for a week and a half because of the treatments. And I remember just getting the port inside of me. I remember every single time, it was about 4 hours, every single treatment. And I remember one of my coworkers, she gave me this little doll, and she said, please take this doll with you every time you go to your chemo appointment. That's us with you, the ladies in the office. And so it was a very, very lonely period in my life. Like I said before, I didn't have family. Most people that I've interacted with who had breast cancer, they had their family, they had their support. And I didn't have anyone. I remember I was roommating, I was in the basement, and I just remember I just had my cat, and that was it. And I was sleeping on a cot and eating TV dinners and just being sick. It seemed like all the time. And so I remember my doctor telling me, she said, you know what, y'all? My oncologist, she was saying, you know what, y'all? I'm so glad to see you, because she said I had to tell someone today they only had a certain amount of time to live. And I remember from that point, from that appointment, it gave me the courage to just stick it out, like just not allow myself to get down. And so there I had to shift the way that I was thinking about, maybe feeling sorry for myself, to almost like a warrior's mentality. And so I can remember just sitting there. And I can remember my doctor, my oncologist telling me, you were 28, we were going to give you everything. We're going to push your body into everything. But you see, what I didn't know was I should have gotten my eggs frozen. And I'll never forget, I was driving to my first appointment and I was talking to my dad. He was like, hey, did you get your eggs frozen? I'm like, well, it's a little too late for that now, Dad, because my appointment's getting ready to start. Hindsight, I wish someone would have told me. And so if I had a social worker, if I had someone to talk to, I wouldn't have felt so alone. I went to breast cancer groups, but the women didn't look like me. They weren't young. They were women, more older. And to be truthfully honest, they were white older women. So I felt like I didn't belong there. And so there again, I go through my journey of, I went through my 6 rounds of chemo, lost my hair, talk about menopause. I mean, I was in the office, hot flashes, mood swings and everything. I just didn't know what was going on with my body. But I just knew I just had to stay focused on staying positive as much as possible. But I appreciate one of my friends, she made a way for me. And I really appreciated that. After 6 rounds of chemo, November came around that year, and I had 36 rounds of radiation. Every single day, Monday through Friday, radiation for, a couple of minutes. And I always say I have the scars to prove it, because it, burnt my skin. And it did some damage, because little did I know, years later, when I moved to Atlanta, Georgia, that I would have a double mastectomy. And so after I had my treatments, and I was on tamoxifen and hormonal therapy, and I remember going back the next day after my treatments, getting my shot for my white blood cell counts to go back up again. I moved to Atlanta, Georgia. I was done with my treatments, tamoxifen and everything. But there was always that scare every single year. Now, when I moved to Atlanta, Georgia, I couldn't afford mammograms at that time. I just couldn't. But one thing I will say was I was introduced to such a large network of breast cancer organizations. And I didn't realize the resources that were out there. And so I found that out because I worked for a nonprofit at that time called Breast Friends. It's no longer around. But I'm grateful because I had an opportunity to, get the BRCA test done, the BRCA1 test. And so it just seemed like we want to see, okay, y'all, if you have kids, are you going to pass it on? And thankfully, I didn't have the gene. But there was still that, I wish I, and I also, after I had my treatments, I also had my fertility levels checked and said they were good to go. But for me, it was always that constant scare of every time I had my mammogram, we see something. We're going to need you to come back in. And I can't tell you the emotional roller coaster for the first couple of years, every 6 months and then every year. But just the emotional roller coaster of, we see something. We're going to need you to come back in. Every single time, always being poked and prodded. And I hated it so much. And it would drain me emotionally. Like literally, it would take me out for, like a week because I'm waiting for results. And so anyway, after that time, so like I mentioned before, I had to focus on my mindset during the first go around of dealing with the treatments and being diagnosed. And so the second go around, where in 2014, fast forward a little bit, in 2014, we had another scare. Okay, y'all, it's like, we've got, because we got the right side now, we're not sure what's going on with the left side. We see some things. And that, of course, I'll never forget the day I was roommating with one of my friends, and I just broke down in her arms, and I said, I'm tired of going through this. And so they said, my oncologist here said, you can get a double mastectomy. And I thought about it for a month, and I said, I don't want to keep going through this, so I went ahead and did it. And so what I learned the first time around was I was not, when I was it took me a very long time to recover. So it took me 2 years for my immune system to recover, where I wasn't always so susceptible to colds and things of that nature and pneumonia. So this time around, before I even prepare for my surgery even start for the double mastectomy, I went on a 3-month fitness plan. And the reason why I say that is because I knew, one, I wanted my recovery time to be short. They said it would take 6 months. I wanted to only be 3. Also, I wanted to be in my most healthiest state as possible in my body. So that way, whatever comes at me, I'm not dealing with so much pain afterwards. So I did go on a 3. So for me, before my surgery, scheduled it out 3 months. I went very hard on my health. Made sure, I lost weight. Made sure I built muscles. Things of that nature. So I had my surgery, but then, I had my surgery, had a double mastectomy, and I had all these drainage tubes hanging from me. I had 4 of them. And I felt like, for me, you know what? For me, I'm a believer, and I said, God, you have taken everything away from me, because I enjoyed my fitness, but I knew, what can I do if I'm not able to move? And so, and I was on a lot of medication, and so there was, some constipation there, and so I knew I had to focus on my nutrition aspect of it. So before I went into surgery for my double mastectomy, and I had a lap, so they took some muscle from my back, and we put it up front here. And so before my surgery, I focused on my physical health. After my surgery, I focused on the nutrition aspect of things. And so I made sure, for me personally, my diet, my meal plan was high in fiber because of the medication that I was taking to recover. And so because of that, and then also too, I was immobile. So I had to really be careful of my calorie intake as well, because I can't do anything but, just get up, make something to eat, and go to bed. And so I'm grateful for that. But then even after that, once I got the go ahead, I asked my doctor, is it okay if I can walk? And she said, okay, yeah. Because I felt like I had to do something, because I was going stir crazy in the house and feeling like I have lost everything. And so I just started walking. And so I'll never forget, I would be in the summertime, I would have these drains, and I would have a sweater on while walking, because I was embarrassed by my drains. Nobody wants to see drains, somebody. And so I would walk because I was determined that I was going to live and that I was going to recover. And so because of that, I was able to recover pretty nicely. Things went really well with the surgery. I have a great breast surgeon, as well as a plastic surgeon that did the reconstruction. And so for me, I realized that, my overall health is so important as a person who is a breast cancer survivor, or even as a woman who can be diagnosed with breast cancer. And so, over the years, I became a personal trainer, I became a nutrition coach, as well as a change behavior specialist. And I've had such a great opportunity to work with I Will Survive Inc. and their patients, their clients, their members. And it's such a joy to see these women go from not really able to really move to being so proud of themselves for not only losing the weight, but feeling good about themselves. They're starting to look good in their clothes again. But most importantly, they're showing up their best selves. And so they're showing up on the calls, they're showing up for themselves, they're showing up in their health. And, it's so important to have organizations like I Will Survive Inc. around and supporting them on a daily basis, not just monthly and not for the yearly, breast cancer awareness. They need support every single day because of their support. They're helping people like me get into my doctor's appointment, learning how to eat, based off of, my current health conditions, but most of all, helping me stay motivated, even in this, even as I'm, being diagnosed, or even as I'm recovering, or even as I'm not sure, because they're providing us with speakers. They're also providing us with people who are willing to partner with us, like Parkland, as well as with the social worker oncologists here. And then also with people like myself who, not only, in the health field, but also a survivor. And so it gives me such a great pleasure to be able to connect with every single one of their members to say, you know what, I've been there. I know exactly what you're going through. I know what you're going through. But guess what? I am partnering with I Will Survive to help motivate you to get you from where you are to where you want to be. And so the question is, where do you want to be as a breast cancer survivor, or as someone who is, a co-breast cancer survivor who is a partner with someone who has breast cancer, or if you are an organization wanting to help, what can you do? And so, I want to encourage every single one of you to take this time and opportunity to take a look at your health. Get that mammogram. Like they just said, they are offering free mammograms. There's no reason why you shouldn't get one. Take the opportunity to support I Will Survive Inc. And, also take the time out for your health as well. It is so key and so important, especially as you're going through your recovery, that you're as healthy as much as possible. But not only healthy as much as possible, but you're also taking the advantage of talking to someone while you're going through the recovery stage of life. But even as you're going through that recovery stage of life, you still want to look cute too. Like I said, look good, feel better, show up your best self. And so definitely be sure to purchase some jewelry from Rebecca. I know I have, and it has definitely helped me, look good, even as I'm in recovery. So my name is Star. I am with the Star Coaching Services. And if you want to reach out and talk to me, if you want to have a chat, if you want to share, your experience, or if you just need someone to, go with you, maybe even to the appointments, or just someone just to talk to about where you are, a fellow sister, I am here. So I thank you so, so much. I really appreciate you guys. And again, please feel free to reach out to I Will Survive Inc. if you have any questions about myself or my services. Thank you.
Thank you so much. Yeah, I appreciate you so much. I commend you for sharing your story all the time. And I mean that wholeheartedly, but not only sharing your story, but defining it as your testimony, and not only understanding it's your testimony, but sharing it with others, because that's what it's all about. And we thank you so much. And not only do you share your story, but you share who we are as an organization every chance you get. And that's very, very clear on all the connections that we have been connected to because of you. And we thank you so much, Rebecca being one of them. So thank you. Thank you so much for sharing that today. Your story is touching so many people, I'm sure, as we speak on YouTube, in this recording, as we will share after this call. So we appreciate you so much. Drop your contact information in the chat, so that way when we share this after, if anyone wants to get in touch with you, they can reach you. Of course, I will share that they can reach out to us and we can connect them to you as well. But thank you. Makita, thank you so much for all that you do day in and day out. Thank you for being that support system in the community and providing that support and just being there when people need it so much. We know how much the work never stops, but we know how important your work is, and we know that our clients are so grateful for you. And I know that we've referred several people to you. We're grateful for the partnership with Georgia Swag. So thank you again for being here on a Saturday. And Rebecca, thank you again for your countless wanting to partner with us as an organization, and really wanting to get this beautiful jewelry out there and really partner with us for the funds that are raised as well. So we appreciate you. Again, we need you. We need your support. So if you heard something today that was compelling, something that touched you, do not be a stranger. Reach out to me. I will make sure that I follow up with this details to everyone on the call today. But of course, if you have any questions, all of you have my contact information. Please reach out. I'm here to help. We're here to help. We want to do this together. We want to help you through all of this. And if you know someone that needs us, just let us know. We're here to help. So without further ado, we'll pause to see if there are any other questions. I know we did run over a bit, so I want to be respectful of everyone's time, even those that have joined on the call today. But are there any questions that anyone has today for our wonderful panel? Any questions for us as an organization? Rebecca, I see a hand up. The floor is yours.
I just want to know, do you also offer services for the caregivers?
Great question. So we have offered services in a number of different ways. I can't say we have a core program that has been identified yet for the caregivers. However, we're always open to thoughts. So if you have some thoughts, please feel free to share those with us. But we have helped to support family units, which obviously includes the caregiver. But no, we don't have a defined program established yet for the caregivers, but we do know how vitally, vitally important that is. And we always say that when someone gets that cancer diagnosis, we know that it hits that person first and foremost, of course, but it affects everybody that person touches, you know. And so we definitely are continuing to evolve. Anissa is fantastic. Our board is fantastic. And we're definitely constantly looking at our programs and how we can shift as needed to make sure that we're providing the right core programs to the community as well. So thank you for that question. It's a very, very valid and something we're thinking of right now as well. So thank you.
Great. Thank you.
Anybody else have questions?
I'm sorry, can I get Rebecca's website for the jury? I didn't see it in the chat.
Yes, it's probably my fault. We were having some tech issues. So Rebecca, if you have it and you want to just drop it back in the chat, that would be amazing.
And what I will be doing is I'll drop in the special link that I will be donating to I Will Survive. So I'll pop that back into the chat box.
Thank you so much. Wonderful. Any other questions? Sierra, anything you want to add before we wrap up the call?
No, thank you to everyone who spoke today. Truly appreciate it. It's out of the norm for us to have this virtually, but I feel as though we did an amazing job. Thank you, Capri, Rebecca, Makita. Thank you so much for your time and everyone who joined us on the call today. Thank you.
Thank you, guys. Have an amazing evening. Have a great weekend. Happy Mother's Day to all of the mothers as it's coming up very, very quickly. Thank you again. I hope that you guys have a great evening and please stay in touch. And you can definitely find this on our YouTube. We will definitely be sending this out as well after this session. So thank you again. Have a great day.
Bye.
Bye.